Good morning. This is Dr. Arun Panda, fish plastic surgeon from Mumbai. And today, what we are going to do here is we're going to be doing a hair transplant for a 26-year-old patient, grade 4, grade 5 androgenetic alopecia. But then, as I was telling you, that we really cannot fit this kind of patients into any of the classifications, because if you see, he still has a frontal tuft here and a few remaining hair in between in small patches here. So we can call it as a grade 4, grade 5 androgenetic alopecia. Now what we are going to be doing here is doing a transplant for him. But unfortunately what has happened is his donor, which is this, as we discussed yesterday, was like the back part and the beard. The donor is also not very strong. So it becomes very difficult for us to do a transplant to cover the whole scalp. In this kind of situations wherein like the patient has already used a hair patch for almost a year, and if you can see, about 3 years back, this was how he used to look, full of hair. The patient comes and shows us, I want to have a similar kind of a look, which is practically impossible to cover because of the lack of the donor area, which is really very difficult. So in this kind of situations, we need to explain the patient that getting this kind of a hairline is going to be pretty tough for us because of the lack of donor area. Now we are going to be doing 2 sittings of transplant, taking the donor from the occipital area and from the beard, trying to harvest as much as graft practically possible and trying to cover. So what do we do in this kind of situations is basically not try and give a very flat hairline. If you try and give a very flat hairline, what happens? The graft requirement increases and then we cannot go back into the vertex area. So what we try and do is try to curve it and make it a little bit of a U shape, which tries and kind of preserves the graft there, and we are able to cover much more beyond what we would have otherwise covered if we would have given a flatter hairline. Okay, now let's start marking the hairline, how we are going to be doing it. So what happens is when we are doing a transplant, we normally try and take care of this, the whole area, right from the frontal part till the vertex, into 3 parts. One is the frontal area, one is the mid scalp area, and one is the vertex area. We never try and do all these 3 together, never try to do all these 2 together. One sitting, one day, one area. Just that's the principle which we normally follow. Let's not try and do 2 things together. One area, one day, one sitting. Second area, second day, second sitting. Third area, third day, third sitting. Never try and mix up these things. So what happens is when you try and do this, the number of requirement of the grafts increases, the time frame increases, and we are putting the patient at risk with local anesthesia. Alright. So now what we are going to be doing is trying and marking the hairline. The first thing what we do is, the most important thing is the mid-frontal point. The mid-frontal point is a point which is about 7, 8, 9, 10 centimeters from the glabella. Okay, so what we do is basically, so we will be trying and preserving the same mid-frontal point which he has. Actually, this is at exactly 6.5 centimeters. So let's not try and do anything, beyond this. So this is going to be our mid-frontal area. Now, the second thing what happens is, from here, what we are going to be doing is designing the hair line here. We'll explain to you about the hairline in a while. But before that, what we have to understand is a couple of more lines. One is the frontal line, which comes all the way here. Second is a temporal line, which I will tell you how to draw the temporal line. And third is a temporal peak. Okay, so these are the few important things which you need to understand. As I said, we are going to be marking, and we have already marked the mid-frontal point. Alright. Now there are 2 ways of marking. So either I do a freehand drawing which goes as the frontal line. As I said, I am not going to make it flatter. I am going to make it U. So what we can also do is we can use a laser device wherein we can, this kind of a device which, okay, so this, if you see, is sitting right at the mid-frontal area, and let me just try to bring it down. So if I am putting it here, this is giving me an accurate line wherein I am not, the line is not disturbed, and we are going in exactly. So if I want to make it flatter, I can just go up like this. So this is getting flatter. But I don't want this kind of a hairline. I can get this. This is quite flat, but if I do this flatter, see, the graft requirement increases so much, and I don't have that much of a graft there. Okay, so I don't have that much there. So what do I do now? I just turn it. So as I am turning it up, so it is going up and it is becoming more and more U-shaped. Okay. Now keeping this in mind, what I will do is I will keep this here and try and make a similar kind of a U-shaped pattern. Rather than this, which is flat, I'm going to be making it a U-shaped. Okay. So my mid-frontal. Okay, and then okay. Now what I have done is I have made some points and I will be drawing it, joining these dots here. So my hairline is going to be something like this in a U-shaped fashion. Alright. Now this actually has saved so much of my graph. Had I been kind of doing this or doing this, I would have spent so much of a graph extra, which I would have rather than I would rather prefer to use this graphs here. Okay, once I have done this, this is going to be my frontal line and this is going to be my mid frontal point. Now the next thing is basically trying to draw a temporal line. So he has lost his temporal line. So temporal line, actually what you do is, so you draw a line from the lateral canthus straight up. Alright, so where it meets this lateral hump, so this is called as a lateral hump, and this is going to be your frontotemporal angle, FT angle, frontal and temporal line. So this is going to be my frontotemporal angle. Okay, so a line drawn from the lateral canthus straight up, straight up, straight up. This is going to be frontotemporal angle. Okay, so this is my FT angle, this is my frontal line, and this is my temporal line. Alright, now what I am going to do is I am also going to make a temporal peak here. So creating a temporal peak actually gives a natural and young look to the patient, because what happens is if you don't have this temporal peak, it looks like somebody is wearing a wig. Say a wig doesn't have a temporal peak. You can't create a temporal peak. So you need to create this temporal peak, which gives you that young look and a natural look. So what I'm going to do here is creating a temporal peak. So there are various ways how we can do a temporal peak, how we can decide a temporal peak. So what we will do is normally, okay, so there are ways how we can draw. So one way is basically you draw a line from the lowermost part of your lobule and to the area which, like for example, this is going to be the mid-frontal line. So you draw a line here and then you draw a line from the tip of the nose to the medial canthus, crossing through the medial canthus, and where this line intersects, somewhere there is going to be my temporal peak. Little lateral to that is going to be my temporal peak. So this is going to be my temporal peak. So this temporal peak is what is going to give me a nice young look. So my hairline is going to be like this, like this, like this, and it's going to be like this. Okay, and in the similar way I'm going to do like this. Try and create always a good temporal peak. Alright, so this is going to be my hairline. Okay, now coming to the point, what has to be done here now? The hairline, as I was telling you, it's actually not a line, it's actually a zone. So when we're talking about the hairline, we define it as something called as a transitional zone, which is in the front part, which is about 0.5 to 1 centimeter of the first area. So this 0.5 to 1 centimeter is my transitional zone. So what do you mean by transitional zone? Is basically that this transitional zone contains single hair, single follicles. They are not multiple, and you don't want very good density in the transitional zone. So the transitional zone of about 0.5 to 1 centimeter is what actually decides how natural the hairline is going to look. Don't make it very dense. You're going to be making it very light, and single grafts. Alright. The second thing what we would also do in the transitional zone is basically give some irregularities. So what we will be doing is giving some macro irregularities here. So we make this kind of V-shaped things here. So these are macro irregularities. And also what we will do is create some micro irregularities. Micro irregularities is just one follicle aage, one follicle piche, back front, so that it looks little natural kind of a thing. So these are going to be my, so, and here what we could do is we make a small peak kind of a thing. So this kind of things are going to be my irregularities. Okay, so this is my transition zone. Just behind the transitional zone, about 2 to 3 centimeter is going to be my defined zone. So this is going to be my defined zone wherein I am going to be putting the maximum amount of thicker grafts like 2 follicular units, 3 follicular units. So this is going to be my defined zone. So this area is what is going to give the maximum density to the patient's face. So this is what is going to give the maximum density. And here in between, what we do is we draw. Can you see this small tuft of hair here? This is called as a frontal tuft. Now when you see a patient from the front, if this frontal tuft is good, actually this actually covers the maximum amount of the density. So if the patient has got a good frontal tuft, you can actually appreciate that he is not very bald and it looks nicer. So what we will be doing is creating a very nice frontal tuft here. So when we create a nice frontal tuft here, this gives a very good density. Okay, so frontal tuft and the defined zones are the areas of maximum density. So here we are going to be putting follicular units with 2 follicles, 3 follicles, 4 follicles, and a single follicles where we are going to do is putting it on the transitional area. Alright. So this is what we are going to be doing for the hairline. The moment we have cleared the hairline, what we will do is we will go back to the mid scalp area. This is going to be the mid scalp area. And this is going to be a vertex. So vertex is day 3 for him. What we have tried and explained him is day 1 we will be doing the hairline. Day 2 we will try and extend as much as into the mid scalp area so that we can cover maximum. Considering that here one very important thing which we have to understand and make our patients understand that he is a very severe case of androgenetic alopecia wherein he has a few follicles still left. Okay. If he is not taking care, he is also going to lose these follicles. He is going to lose this hair also. Now imagine I have transplanted hair. We have seen so many patients coming to us. Then the graft done the hair transplant about 7 years back, and the transplanted hair they are still present, but they have lost the native hair, and it looks really bad. So you need to explain the patient that first thing is try and preserve this native hair which is there. And second thing is, if he loses, which probably he is going to lose, he might require third sitting, second sitting, or whatever it is. So we will again, actually that's the reason we actually, when the patient comes to the good donor area, don't be very aggressive, because if the androgenetic alopecia is still not stabilized, it's still unstable, you might require, you are definitely going to require second stage, third stage after like a few years. For him, at this point of time, it's very important from him, from a social stigma point of view, and he has to get married and things like that. So it is important for us to give him as much as possible. After 5 years, 7 years, probably he wouldn't require anything, but this point of time he requires it. So we need to cover as much as possible. Considering that his donor is weak, let us not go and do the vertex, because he is also asking me that we'll be doing the vertex. It is practically not possible. If I am going to cover the vertex, I will not be able to do justice to the front line, hairline. So at this point of time, what we will do is create a nice hairline, that too not flat, take it U, and give him a nice hairline. Try and cover as much as possible till the mid scalp area. Alright. Give him a good temporal peak, because this temporal peak is going to give him a good natural. This is a small trick which gives a very natural look and very young look to the patient. Okay, this temporal peak. So imagine once we have created this. Okay, now once we have marked this, what we have to understand here is, when we are, as we were discussed yesterday, that we do FUE technique, wherein like we make the slits in the recipient area and then we harvest the graft from the back and we put it here. Now, a couple of things which are very important here. is something called as the angle and direction of your making the slits and how you're going to be placing your the follicles here. Angle is basically the angle in which the hair follicle exists or exits out from the scalp. Okay, and the direction is basically in which direction it is going to be flowing. Direction is like anteriorly, posteriorly. It's very important for the hairline. It cannot be like this. The major mistake which we see in a lot of redo transplants is basically the grafts have been put like this. Never like this. Never like this. It has to be very, very, very acute, almost 10 to 15 or 20 degrees at the max. So what I'm trying to tell you is that in putting the incisions, our incisions has to be sleeping like this. So our slits are going to be like this. Imagine this is my 18 gauge needle. So this is going to be like this. Okay. So as we go down here, this thing is almost 0 degrees. It is almost like with the skin. The incisions are going to be with the skin here as we come onto the temporal peak area and these areas and all. So it has to be almost flat. It's almost 0 degrees. While here 20 degrees is maximum what we can be looking at. Never 90 degrees, 80 degrees, 70 degrees, no. And when you're talking about the direction here in the frontal hairline here is always like this. Is coming like this, and here it's always like this. While here it is downwards. Here it is downwards. Okay, and here it is going to be. So you can actually appreciate the present here. You can actually see that the follicles, how they're growing. So if you can see here, the follicles or the hair is actually going. So my direction is going to be like this. My direction. So if I see here, my grafts the follicles are growing like this. So my direction is going to be like this. The direction is going to be like this. So this is a major problem when people, when we get patients, they're not very happy with the transplanted hair because the hair stands like this. It looks very bad. It looks very, very, very bad. So it has to be always acute, almost 20 degrees, 15 to 20 degrees. So angle and direction, especially in the hairline, is very important. Here probably you can manage, even if it's slightly this thing, so we can always manage. But here also actually it has to be, anteriorly placed. An angle of almost 40 degrees, 30 to 40 degrees is good enough. So that's about your angle and direction when we're talking about. Now talking about the donor, so we have basically in FUE technique, we have two donor areas which we normally utilize. The occipital area, right here, 2.5 inches, right from the external occipital protuberance, 2.5 inches, which goes back all the way till the temporal area. So we try and stop a little bit behind the behind a line which is drawn just above the external ear. We stop it here and then we take it from here. So that's a 2.5 inches area. Since we don't have enough of donor area here, so fortunately he has got a little bit of a better beard, so we will be utilizing the beard. But this beard hair is never utilized for the front, never, because the texture never matches. So we will be using this to give density. So the best part about the beard is basically it is very thick, so we can use it to give a good density. So we're going to improve onto the density here. We're going to be mixing it up in the mid scalp area, but never on the front, especially in the transition zone. So we have to be behind it, so give the density. So transitional zone, single follicles, defined zone 2, 3, 4, frontal tuft maximum, mid scalp whatever practically possible, beard, mix it up in the mid scalp area and the frontal tuft to give the good density. So that is how it's going to be, and you're going to be doing taking the occipital today and then little bit of occipital tomorrow and the beard tomorrow. So probably we'll be able to harvest about 500, 600, 700. Let's see how much we can do from the beard area. We'll try and do that. But for him, I think this amount mid scalp area, even if you are trying to do, it's going to be good. So let us see how we are going to be doing it. Guys, keep watching us, and we will be doing a lot of more videos today for the FUE technique which we are going to do for him today.